Currently, the result of the both program, both studies, the SAKURA 1 and SAKURA 2, which together make up the SAKURA program, the whole package has been submitted to the FDA already, and it is being reviewed by the FDA. So hopefully, in a few months, one will be able to hear back from the FDA whether it can be approved and therefore have the indication for non-infectious uveitis. And certainly, it would be wonderful if all the patients with uveitis are being managed by uveitis specialists. But because the number of uveitis specialists is very small in the United States and throughout the world, there's a very limited number of uveitis specialists. Many patients with uveitis are often managed by physicians who mainly are retina specialists, and especially those who retina specialists who manage ocular inflammation of the posterior segment. So to many of our colleagues, especially in retina and many ophthalmologists, if the treatment can be delivered in a locally fashion, that would be a lot easier, because certainly it's easier for the patient not to undergo systemic treatment and thereby subsequently a lot of potential systemic side effects. But certainly for the provider, all of us who are ophthalmologists in general, much more comfortable with local treatment rather than systemic treatment. So to me, this would be quite a revolutionary kind of care should we be able to have this modality and this mode of treatment for the patient, because it's delivered locally. Now, one can argue that one also have local delivery of corticosteroid, which is very true. We have several possibilities for that, several options for that. But local corticosteroid does have its side effects, namely the formation of cataract or the acceleration of cataract formation, as well as most likely the induction of ocular hypertension that can lead to glaucoma. So certainly there's significant side effect associated with that. So hopefully, if we have an immunomodulating agent that are able to control the inflammation, such as intravitreal sirolimus here, and at the same time does not have the side effect that's associated with corticosteroid, then that would be very welcoming. So for many patients who have diseases, this will be a very welcoming addition to the tool that we have to care for them, because now hopefully we can control the eye disease without subjecting the patient to systemic side effects.